Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine for our patients, our members, and the communities we serve. Thanks for tuning in.
Good afternoon and welcome to the POMA Does podcast, the official podcast of the Pennsylvania Osteopathic Medical Association. I'm your host today, Tyler Burke, and today we are joined by Sean Neal, the Vice President of Advocacy and Political Affairs for the American Osteopathic Association. Thank you so much for being here, Sean. I just want to give a little bit of background to our listeners about what you do. So Sean leads the AOA's federal advocacy efforts and works directly with policymakers, physician leaders, and state osteopathic associations. This is where I have gotten to know Sean through most of our work in Washington. I have been part of a Fly-In, DO Day, and a few other collaborations that we have had. And I think it is so important for POMA's members to understand the value that AOA has at the federal level. So, Sean, in such a ever-changing healthcare policy world, from workforce shortages, scope of practice, and Medicaid, what is your team focusing on and how do you keep your arms around it?
Thank you so much for that question. First and foremost, thank you for having me on today. Once again, my name is Sean Neal. I'm the Vice President of Advocacy and Political Affairs for the AOA, and it has been an absolute pleasure to work with Tyler and Andy and really all of the POMA staff and leadership to really advance common sense health policy, both on the federal and state level. I'll get into it a little bit later, but I will say that if we want to be more effective, both on the federal and state level, we need to have more physicians and students engaged. So I'm going to start this conversation out in kind of multi-parts and multi-tiers, but I'm going to go ahead and start by addressing the question that Tyler mentioned, and that's kind of what Congress is currently working on and what we can do together to kind of advance that policy that I mentioned earlier. So for this week, we are currently recording right now during the week of Memorial Day, and that is a work period, meaning that Congress is on congressional recess. But even though they are in that work period in recess, healthcare policy activity has definitely not slowed down at all. Even while lawmakers are really back at home in their district, congressional committees and federal agencies and staff, they really are working behind the scenes on major healthcare priorities. And so right now, much of the focus in Washington has shifted away from floor votes and more towards broader policy developments and negotiations. So that includes Medicare physician payment reform, CMS rulemaking, healthcare affordability, administrative burden reduction, physician workforce issues, and really kind of a broader federal spending discussions, which we'll also get into a bit later as well. One of the biggest developments before Congress left town was a major health House Energy and Commerce Committee hearing, which focused on Medicare physician fee schedule, MACRA, and long-term physician payment reform, which is really so desperately needed. And it's something that we have been working on for, it seems, more than 20 years now. And that hearing was important because there is a growing bipartisan recognition that the current Medicare physician payment system is simply unsustainable. And I think this is something that many of our members have known for a very long time, but once again kind of speaks to the importance of being loud and vocal on these issues that are impacting you as a physician. And so physicians continue facing rising costs, as we all know, inflationary pressures, staffing shortages, growing administrative burdens, while reimbursement remains unstable and in many cases inadequate. For the AOA, this continues to be one of our top federal priorities, and I know it's something that POMA is working very hard on as well, particularly establishing this annual stable inflationary update to Medicare, which is tied to the Medicare Economic Index. And so this issue is especially important for osteopathic physicians because many DOs practice in primary care and in rural communities and underserved areas where financial pressures are really acute, right? They're facing it in a unique way. And so ultimately, payment instability impacts patient access to care. So when we go and talk about Medicare physician payment on Capitol Hill, we always refer back to patient access to care. At the same time, CMS is driving a tremendous amount of healthcare policy through the regulatory process. And so one of the major areas receiving attention right now is something that nobody loves, and that is prior authorizations and getting that process reformed. This is obviously not only a burden to physicians, but patients as well getting the appropriate treatment that they need. And then, of course, administrative burden reduction, which is going to be associated and tied to prior authorization reform. CMS continues advancing proposals focused on electronic interoperability and streamlining data exchanges between providers and payers and improving prior authorization process as a whole.
Sean, I think with everything that's going on, one of the biggest issues for our advocates is drinking from a fire hose. And so what are the main ways that AOA and more specifically you and your team reach out to folks, and how can they get involved?
That is something that I mention quite often within our department. Is healthcare policy is super complex, right? You have everything from physician issues to insurers to PBMs to the pharmacists, you name it. There's so many different facets that are tied to healthcare, and they're all interwoven. So it can be really challenging and difficult to explain, and especially to lawmakers. When lawmakers are writing bills or they're doing their speeches to their audience, they often speak at a 4th to 6th grade reading level because they need to have their constituents understand this in an easy way. Furthermore, when they're on the House or Senate floor, they need to be able to convey these issues in a easy to understand way. And that's where we come in, and that's where you come in as well. And so we do this through something called the Osteopathic Advocacy Network, or OAN. So the OAN is the AOA's grassroots advocacy network that helps connect physicians and medical students and residents and other advocates directly with their lawmakers, both at the federal and state levels. So a lot of physicians want to get involved in advocacy, but they might not know where to start or think that they need political experience to make a difference. And that's not really the case. Reality is lawmakers want and really need to hear directly from you who are caring for patients each and every single day. Physicians obviously are going to bring real world experience and credibility to the policy discussions in a way that very few can understand. And so through the OAN, there are several easy ways for physicians and students to engage. Number one, engaging with the grassroots campaigns that we send out through the Advocacy Action Center. So contacting your members of Congress on key healthcare policies that I mentioned earlier. You can attend DO Day on Capitol Hill. DO Day on Capitol Hill is such a rewarding experience. You get to talk with the lawmakers directly about these issues. And sometimes if you're a first timer, it can be a little intimidating. You're going on Capitol Hill, you're out of your comfort zone, but we want to make it as comfortable as possible for you. So when you come in as a physician or a student, we will provide all the educational materials that you need to set up that day for success. So we'll make sure to give you the talking points. We'll have videos on it. We'll do mock meetings to make you feel more comfortable. And what I have found is that the first meeting can go sometimes a little rough, not rough, but not as smooth. But as they progress throughout the day, they get better and more confident with their pitch and what they're advocating for.
Just to quickly throw in some personal experience here, I attended this year's DO Day as an advocate and one who has more experience. And Sean and his team did an absolutely phenomenal job of making sure that the students and residents were put and arranged with experienced advocates so that in those moments and in those meetings that the people who needed to tell their stories the most were confident and ready, willing, and able to tell those stories. So it is just a kudos to Sean and his team. So thank you for that.
And that's the other thing too, is we always want to make sure to partner our advocates with some seasoned, more experienced advocates who have been there before. So we just, again, want to make it as comfortable as possible. And Tyler, to your point about specific people talking about specific things, we cater the issues to our audience as well. And the issues that we talk about are always going to be nonpartisan. Both Republicans and Democrats can agree on these issues. And we also want to make sure to advocate for issues that we are hearing the most from our members as well. And on top of that, we also want to make sure that they have a possibility for advancement within Congress. So we're not going to advocate for something that has no chance of moving. What would be the point, right? We need to set ourselves up for success. And again, we can't do that without advocacy from physicians and students.
Absolutely. So Sean, thank you so much for joining us. I wanted to just highlight quickly that we will put in the link to join the Osteopathic Advocacy Network in the description of either the YouTube or the podcast that you are listening to. But as we are closing out here, one of the things that I wanted to say is as a POMA staff member, we work hand in hand with the AOA and vice versa. So if you are hearing this and you want to get involved in either way, please feel free to reach out to me and I can connect you with Sean and his team and we can move on from there. Sean, any final thoughts?
No, just just want to thank you so much for having me on today. If you're interested, let us know. We are more than happy to engage in advocacy efforts on your behalf or with you. So looking forward to working with you to advance common sense health policy. So thank you.
Thank you so much.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts, and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube. Or email us at poma@poma.org. We'd love to hear from you. Join us next time for another edition of POMA Does.